excuse me, Jane Morgan, a cardiologist and former executive director of the COVID task force at Piedmont Healthcare in Atlanta. Dr. Morgan, always good to see you. What are your thoughts on this autopsy report? Because from what I understand, Matthew Perry, as the report states, he had been receiving ketamine infusion therapy, but usually that kind of cleans out of the system. And apparently he had last had that therapy a week and a half before his death. But ketamine was found in his system?
That's true, Amara, and thanks for having me this morning. You know, what's interesting to me, certainly as a cardiologist looking at this report, is that it also states not only drowning, but coronary artery disease was contributing to this. And we know that coronary artery disease, especially in older adults, is a relative contraindication to this medication. In fact, the American Heart Association lists ketamine along with propofol as compounds that need to be thought of in extreme caution because they can exacerbate any medical conditions, any cardiac conditions that you have. It also should be used in caution, but generally when it is being used in conjunction with people with mental health disorders, the levels are low enough such that it is not a concern, what we call these sub-anesthetic levels. But his autopsy report seemed to show that his levels were in line with general anesthesia, so well above the sub-anesthetic levels that are recommended for cardiac safety.
So according to the report, it was the acute effects of ketamine and drowning. What are those potential acute effects? I mean, does this happen immediately after taking them, and what could they be?
So the acute effects really are respiratory depression, and this respiratory depression can put a strain on the heart, increase the demand for oxygen of the heart, and therefore if you have underlying cardiac disease, as Matthew Perry seems to have in this autopsy, it can further exacerbate that entire episode. But it's really the acute respiratory depression that is really driving the entire effect. And then you mix that with the body of water and the drowning ensues.
Can you talk more about how ketamine is used for what kinds of patients and also the risks that are associated with medical use versus recreational?
Ketamine is really used as an anesthetic for anesthesia. Recreationally, it has moved into the area of a hallucinogenic, sort of a dissociative effect where you have an out-of-body experience. And the half-life can vary depending on the route of administration, whether it's taken as a liquid or orally or snorted as a powder or even injected. The IV administration, the effects are very rapid within seconds, intramuscularly within minutes, and the oral form generally takes up to 30 minutes, but the oral form also has a longer half-life, sometimes up to 6 hours. Even after the half-life, after the drug has expired, the effects of ketamine can last up to 24 hours.
So up to 24 hours, although according to what we learned from the report, and Amber pointed it out, the last infusion was a week and a half ago. Does this suggest abuse, that there was an acute effect and this happened a week and a half after the last recorded infusion of ketamine?
And certainly with the last infusion, an IV infusion where the half-life is relatively short, within an hour, we wouldn't expect to still see it in his body. What we don't know is whether or not he was also being treated with an oral form or whether this was a recreational use. I just don't have that information.
How do you compare ketamine for treating depression to the use of other antidepressants such as Zoloft or Prozac?
You know, when we look at ketamine, certainly it has to be monitored very carefully in these very special clinics with doctors who really know what they're doing, because it can have interactions as well that can be unpredictable. And certainly we want to make certain that if people are prescribed ketamine, and it seems that Matthew Perry was one of these people, that he is under very good doctor supervision and doctors who really are familiar with managing these medications, since they are used for depression and for anxiety with quite a bit of success.
All right, Dr. Jane Morgan, we'll leave it there. Thank you very much.